Now, today, our speaker for today is Dr. Nkossi Dambita. Dr. Dambita is the Director of Clinical Services at McFarland Associates, as we know it, as the African American Health Program that we have been partnering with for about the past 15 years. He is a public health physician and received his training in epidemiology at State University of New York up in Buffalo. That's where he received his Master of Science. He also received a Master of Public Health and Health Systems Management from Tulane University in New Orleans, and a Master's in Health Science Informatics from Johns Hopkins University over in Baltimore. He's directed public health programs at the state and local levels and internationally. Okay, I spoke with Dr. Dambita was initially supposed to talk today about AI and healthcare and health records. But when the opportunity came for us to celebrate and recognize Heart Health Month, I spoke with him and he welcomed the change. Okay, so we're going to turn this over to Dr. Dambita, and then after that we'll have some more announcements that we'd like to make. So please welcome Dr. Dambita with a Colesville welcome. Dr. Dambita.
Yeah. Thank you so much, Dr. Smith. And thank you, Colesville's United Methodist Church, for this warm welcome. And I appreciate the fact that you all have your red on. Just to let you know, red is the color of the African American Health Program. And I don't know why I did not wear my red today. You put me to shame, but it's all good. I love the month of February for several reasons. Dr. Smith mentioned a couple of them. It's Health Month. And Heart Health Month, and that's very important in everything we do. And I usually, when I talk about heart health, I say the heart is my favorite organ in the whole body, because it works so hard, continuously. And if the heart stops working, you know what that means. And also, it is the African American or Black History Month, and I still celebrate Black History Month. And it's Valentine's Day, Valentine's month as well. So for all those good reasons, and it's a short month. I like the month of February. Let's talk about something that can lead to the heart stopping. We call it the silent killer. That's hypertension, also known as high blood pressure. I'm going to use those two terms interchangeably. So let's see if I can give you just a quick overview of hypertension and heart disease so that we prepare ourselves for heart health. We will discuss the risks, got to know those risks, and we want you to do something about it, not just listen to what we're going to do. And then we'll have some time for questions. So, what is high blood pressure? Anyone wants to chime in? Yes? What is high blood pressure? Well, yes, go ahead.
High blood pressure is the force of the blood against the arteries.
Yes,
The heart pumps the blood.
yes. When the heart goes whoomp and pumps blood out, it applies pressure, just like your hose applies pressure to the arteries. And also, it takes a break. And as it relaxes, that's why you have two ways to measure blood pressure. One is called systolic, and that's an upper value. And the lower one when you get your blood pressure checked, it's always those two numbers. People get confused. Which one tells that whether you have high blood pressure or not? So the lower one is called diastolic. That's when the heart relaxes and ready for another pump. All right? So normal blood pressure, what we call normal blood pressure, should be, the top one should be 120, and the lower one should be, we call diastolic, should be 80 millimeter of mercury. And if it exceeds 100 or 80, either one, doesn't have to be both, either one goes about those, the above 120, between 120 and 129, we just say that it's elevated, okay? Crosses over, goes to 130, to 139, we say that's stage 1 of hypertension, okay? And if he goes above 40, from 140 to 150, that's what, or higher, we say this is stage 2. Now, many of us, because we're not aware of what is happening with our blood pressure changes throughout the day. And people find themselves with blood pressure that exceed, the systolic may exceed 180 millimeter of mercury, or the diastolic exceeding 120. That's what is called a hypertensive crisis. And the crisis breaks down into two different ones. There's what is urgent. Urgent, you got to do something about it, and that means that end organs have not been damaged as yet. And there is emergency. The emergency is what you find someone having a stroke or having a heart attack. Okay, so that's what it is. Those numbers that you get when your blood pressure is taken. So, and let's talk about the hypertension. One is called primary hypertension. And that one, we said that we don't know what it is, okay? It's just there. It's also known as essential hypertension. And as opposed to the other type of hypertension, which is called secondary hypertension, and secondary hypertension is due to kidney disease, is due to heart hormonal imbalance, or some other medication that can cause it. So that blood pressure, there is an identified cause, and if you address a cause, it goes away. But the one we're talking about, when we're talking about the silent killer, it is the one that is the primary hypertension, and for which you got to do something. You got to do something about it. We'll explore in a little bit what what can be done. There's a lot of things that can be done, but so remember, primary hypertension has no identifiable cause, and secondary hypertension has a cause. And let me go to the next slide. Often we say it's a silent killer because you do not know. It just happened. This one lady I spoke to, she left, but she said a friend of hers who did everything right just had a heart attack and passed away last November. That's what happens when you're not aware of it and you're not doing something about it. And it leads, because it will lead, eventually will lead to complications, and the complications are multiple. The heart is the primary target, and that's why we'll talk a little bit more about heart disease. and the kidney, and also in the brain. Stroke, you can have a stroke in the brain as a result of high blood pressure. And also, people go blind because of high blood pressure. So it is a serious matter. And I want you to understand that it is a serious matter. So what do we do? What can we do about it? What can we do about it? The main thing, the first line of treatment when you begin to have high blood pressure is lifestyle changes. Lifestyle changes. And that's what we preach all the time at the African American Health Program, and with good results. It's a wake-up call when you are told that you have a diagnosis of high blood pressure. You got to do something about it. You have to reform yourself. And if that fails, you have to go on medication, and there are lot of medication, because we've been treating high blood pressure for a long time. You have diuretics. Usually that's the one that makes you urinate a lot to reduce water, fluid, to reduce fluid in your body, and that does help, because remember we say that blood pressure is that pressure. The more water you have in those blood vessels, yes, the pressure is going to go up. All right. So we have there are diuretics. You have beta blockers. For some reason, us black people, we don't do too well on beta blockers. And the other thing, we also known for being non-compliant. We don't adhere to the prescribed medication. And when that happens, you go off beta blockers, there's a rebound effect. The situation gets worse, okay? But there are other, ACE inhibitors, you have calcium channel blockers, and there are multiple other interventions. And so, if you don't take care of your hypertension, inevitably you're going to have a heart disease. And heart disease here, I'm going to call it all the diseases, a group of diseases that affect the heart and blood vessels in your body. Okay, I call it heart disease. Multiple atherosclerosis, you have congestive heart failure, it goes on. And what happens is that on here, I don't know if I have, on the, I guess on your left side here, this is a normal artery wall, and this is what happens when we don't eat the right kind of food. We load ourselves with fatty food. It's called also what? Cholesterol. Cholesterol will build plaque inside those vessels, and that's also this is also a way of giving you high blood pressure and eventually have some blockage somewhere that would have catastrophic consequences. So they are just like with hypertension. The risks are in three categories. You have, let's see what they are. Genetics plays a role. I usually ask a question about, sneak a question here for the audience to respond, but we're going to skip that. So many of the things, if it's in your genes, there's nothing you can do about it. The environment, there are environmental factors. Some of them, we cannot do anything about it. If you're constantly in a state of stress, that's external to you. You have nothing to do with it. If society is going through major changes too quickly, and the body doesn't have time to adjust. Okay? You cannot control those. If it's a geopolitical, it's societal changes, you can't do anything about it. And but there are some environmental things that we do to ourselves, and that's mostly smoking. Glad smoking is gone. It's coming back in a different form. Okay, the vaping and all that. That's still smoking. It's bad. Okay, but the lifestyle part of it through diet, what you eat. What you eat makes you. If you eat junk, you're gonna be junk. So watch what you eat, and we will explore some of the diets that are recommended to help with blood pressure. Not having any physical activities. What I mean by that, the recommended regimen is to have something like 150 minutes of moderate exercise a week. 150 minutes, that's it. You will make a difference. If you can do vigorous exercise, if you still can do vigorous exercise, that is even better. So talk about physical activity, we talk about diet, we have to talk about stress. Learning to recognize stressors in your life and doing something about it. So those three categories, you can look at them another way. That those that we mentioned are non-modifiable. You cannot do anything about genetics, you cannot do anything about race, you cannot do anything about age. But you can change your diet, you can put yourself on exercise regimen. You can reduce your weight. Obesity is a societal problem. And I believe Ozempic is not going to cure it all. Because when you stop Ozempic, you start gaining the weight all over again. And I don't know, with all the major side effects that those GLP-1s cause, why the easiest way is to do those things. Watch what you're eating, and then exercise. That it's once you get into the habit of doing, it's easy. And then alcohol. Alcohol is not. They said maybe just a glass of wine a day. It's not bad. It might even help because it has. I like that. Stress, yes, stress is a major cause of hypertension. So let's see some of the risks that we're talking about in hypertension. Maybe I'm going wrong. Risk factor, family history. If mom, dad have hypertension, chances are that you may be predisposed. You may be predisposed. And remember one thing, if you forgot everything, you may be predisposed, but you're not predestined to have it. You may be predisposed because of genetics, but you're not predestined to have it. So you can still do something about it. Age, there's nothing you can do about it. Race, we cannot do about it for some reason. Us, black people, we have a higher rate of hypertension, heart attack, kidney disease, and all that. Okay? And it may be stress that transcends generations, and we are living the consequences. Gender, it tends to favor hypertension, heart disease tend to favor men. We get it more than our sisters. Weight. I've mentioned that enough. Physical inactivity. High cholesterol, yes. ABCs. Remember the ABCs, always go to your doctor. You say you want the ABCs. The A is for A1C. That check whether or not you have sugar in your blood. That's diabetes. B is for blood pressure. Monitor your blood pressure all the time. And C for cholesterol. Those three things, if you mind them, if you know your numbers, you are in good shape. Avoid alcohol, smoking, no for smoking, and taking your medication as prescribed. All right, I'm going to ask you a question. It's a true or false question. You tell me. Heart disease is a disease of senior citizens. Is that true or false? Yay! I love that. Yeah, it is false. Because just young people are subjected to the same stress that we're going through, the same thing that we're going through. And younger people are getting those chronic diseases at a younger and younger age. So that's false. So one thing that is a source of and that came up as a risks. Was surprised in the Surgeon General's report that came out, a couple of years ago, that loneliness and social isolation plays a major role in heart disease and hypertension. The people who lack the support, the social support, are vulnerable. And if you have a support in society, that lowers your risk by almost 36%. And that study was done mostly in African American population. The effect of social isolation and hypertension risk is even greater than other major risks such as diabetes. Okay? So that's that. When I read that report, I was just I was shocked. I was shocked, but that's a reality. So in terms of heart disease, physical and mental health is part of it. When you lose a partner, life partner, that's a problem. The isolation, those are the causes of isolation. People who do not have transportation, you've been active all your life, retirement, and or you don't have the family structure with you, and all these can contribute to it. So I'm mentioning those social factors that are important, and this is something that we did not consider before. So what can we do about it to reduce the risk of hypertension and heart disease? There are three. We already mentioned those, and I keep repeating. That's the way I teach. I keep repeating, and maybe it will stick. So again, the strategies, as I'm trying to demonstrate to you, are plain and simple. Let's explore it. Healthy eating, and the healthy eating, we have to have salt restriction necessarily. You'll be amazed by how much you can decrease your blood pressure by just reducing the amount of salt. And we're not aware of how much salt we consume on a daily basis. Regular physical activity, I'm going to say that again, managing stress. Eating healthy. What I mean by that? Look at some of those factors I just mentioned to reduce the risk. Have you heard of the DASH diet? Okay. DASH stands for dietary approach to stop hypertension. It's a huge study involving millions and millions of people. over several years, and it proved that you can reduce your the average blood pressure by at least 12.2 millimeter of mercury, and that's significant. Physical activity also does reduce by between 5 and 8 millimeters, and stress reduction about 5, and reducing salt also is almost the same as doing more physical activities. Isn't that amazing? Just limiting salt can bring your blood pressure down. That's what I'm saying. Lifestyle is, again, once again, the key. So let's talk about the other diets. The DASH diet is mentioned because it has the most significant result, but other ones, you've heard of Mediterranean diet, the vegan diet. We actually, at the African American Health Program, we have every Thursday afternoon, we have a nutritionist that preaches about plant-based food and the importance of eating more vegetables, more fruit, and avoiding animal product. But we do not try to convert people to veganism. We're just telling them that there is virtue in eating more vegetables, eating more fruit, and avoiding fat food. So big emphasis on vegetables, plant-based food, protein. The DASH, same thing, more fruit, vegetables, and low dairy food. And you need to cut back on foods that are high in saturated fat or cholesterol or trans fat. Avoid those. Eat more whole grain food, fish, poultry, nuts, and limit the sodium. Sweet, Coca-Cola and all these things, leave them aside. Sugary drink, and red meat. So salt intake. The average person, each one of us here, I had the inside track, so I've been reducing my salt. Intentionally, I don't add salt to my food, but on the average, we have about 3,400 milligrams of sodium per day. That's how much, whether you like it or not. If you eat outside, if you cook, and salt is addictive. Salt is addictive, just as sugar. And all those processed food, and if you dealing with processed food, yes, you are bound to consume a lot of sodium. And the recommended guideline is actually around 2,300 milligrams per day. That's about just 1 teaspoon of salt. That's recommended. And to avoid hypertension, you need even to go lower than that. And that's what the American Heart Association recommends, that you should limit at 1,500. Let's see some of the food that we usually, and I've already mentioned the importance of reducing salt. For every 2,300 milligram of reduction in sodium intake, the systolic blood pressure falls by an average of 5.6. That's what I showed you the chart earlier, between 5 and 8. That's what it came from. And the diastolic is between, it's about 2.3 milligram. Okay, let's look at this small bag. All right? Guess how much salt it has? That's a smaller size. Okay? I kid you not. You eat one of these, that's all the salt you need for the day. Okay? So you have to read those labels. Please do. When you go into the supermarket, read the labels. And sometimes they will trick you. They telling you about servings, and you don't know what the servings are. Servings changes for different people. And meanwhile, they are giving you an addictive product. So also the thing to do is to avoid fatty meats, processed meat. They all have salt, potato chips, pretzel. I know Super Bowl is this evening. So you're already loaded up with your salt. And please indulge, but for the rest of the week, don't touch any salt at all. Okay? And one of the major sources is canned soup. Yeah, the canned soup, they are loaded with sodium. So what, you know all of this, and I skip around for the sake of time, but that's action time. We have, what can we do? You have to monitor your blood pressure daily, okay? You have to. If you don't have a monitor, there are so many devices around, grab one. It's a lifesaver. This is how you identify that silent killer before it goes to work, all right? And it helps your physician when you share your status with your physician. And there's a good reason for that. You go to the doctor, there's what is known as a white coat syndrome, okay? You're there, anxiety, right? Stress, that will raise it up. And that's what he's going to use to prescribe medication to you, okay? That's not good. So you have to take control yourself of those measurements. And I've already mentioned that it helps them to adjust your medication, and you can use it as a guideline to change your lifestyle. I'm going to skip to the next one. So you get one of those fancy or basic blood pressure cuff. You got to know how to do it. We said the measurements you take at home is better than the one in your doctor's office. But you have to be able to do the right thing. People sit down, cross their legs to take their blood pressure. No. And one of the reasons you go to your doctor, they don't tell you. They just put the cuff over your clothes. That's a no-no. They know better than that, but they do it anyway because they have to rush you through the process. So don't take your blood pressure when your bladder is full. Okay? Empty your bladder, and then don't drink any caffeine just 15 minutes before taking your blood pressure. And don't smoke just before you get your blood pressure taken. No alcohol, okay? Don't cross your leg. And when you sit down, you have to have support, something to support your back. So you sit down like this with a support, and your arm above at the level of your heart. That's the correct way of taking your blood pressure. And as you do it, if you're taking it on your left hand, consistently just take it on that arm. Don't jump from one to the other. And also it helps to take it at the same time every day. And I mentioned that at the beginning because it varies throughout the day, okay? So you want to be able to detect changes in your blood pressure. Temperature also is important. So there are many devices. Some of them, you have the wrist, you have watches. I wouldn't recommend the watches, not as yet. They may be perfecting them. But those that you can actually put it around your arm better than, and your smartphone can connect. You can collect the data, so you don't have to write it on paper. If you don't have a smartphone, most people do nowadays, you can sync it with your device and it'll keep track of it. And one of the things that we offer at the African American Health Program is that if you have problem with high blood pressure, come to us. We have RPM, what we call RPM, is remote patient monitoring. We will give you the device and asking you that at least 15 to 16 times a month that you take your blood pressure at the same time, following those guidelines I give you. And the beauty of that is that we automatically get, the minute you take your measurements, we get the readings. And if something is wrong, then someone will call you, either a nurse or a community health worker, to see, did you take your medication today? What is happening? Maybe this is time to contact your primary care physician. And if it's really a crisis, hypertensive crisis, as I described it earlier, go to the urgent care. So let me show you some of the, so we monitor high blood pressure, used to monitor glucose, but now this is obsolete technology because I would recommend the CGM, continuous glucose monitoring. And if your insurance can allow you to get one, that's great. And we can measure your pulse and oxygen level, and also to monitor weight scales, the scale, smart scale that gives us those numbers. So, a quiz time. Factors that affect blood pressure readings: cold temperature, cough over clothing, cross leg, A and B, or all the above? Yes, I'm so happy. Yes, very smart group. And physical activity is good because you strengthen the muscles, improve blood flow, improve overall health, but before you get into an exercise, I mentioned earlier, to do moderate exercise, check with your physician or your clinician before you do it. Okay, another quiz. True or false? The older you get, the higher your blood pressure. There is nothing you can do about it. Yes. We went through strategies so that you can do something about it. And it's not a matter of age. Young people can get it as well. So, yes? Yes, you can ask questions. Yeah.
Often, as you get older, blood pressures that are higher seem to be a whole lot more acceptable.
Yes.
I'll go to the doctor and I'll have 130. 130 is high. But they say that that's normal for someone my age.
Yes, because, just like a hose for water, after a while, if you use it for a while, it weakens, and the water has to pump harder. So it is normal, and if it's an elderly person, the systolic tend to be higher. And so the clinician will pay more attention to the diastolic, okay? But this is a normal process of aging, and that's why big changes, if you're taking it consistently and it's good, you're on medication, it's not as worrisome as than otherwise. So my challenge to you, what is one thing that you will do differently to reduce your risk of hypertension and heart disease? I want some brave souls to tell me what you will do.
Diet.
Diet. Yes. Give me a hand. Anyone else? Exercise. You give her a hand. Yes. Okay. Yeah, reduce stress. Good, good, good. So, yeah, you got it.
I like that one.
Do more, yeah. Rebuild your social network. Yes.
That's what you got.
Yeah. Sleep is important. Sleep is part of it. I didn't mention it, but sleep is very important. Sleep hygiene. You gotta mind that. And oral health too. Oral health. It's amazing the number of pathologies can be detected by just looking at the mouth. And only your dentist is, actually your dentist, we don't go to dentists. And believe it or not, the greatest disparity in terms of health, it's in the area of oral health. We just, and if I ask, yeah, question, Elizabeth. Yes, I would say in the evening before you retire. That's a good time to take it. If you're taking it in the morning, don't just take it when you get out of bed, because when you laying down, you are more in when you're in a prone position, you are also in hypotensive position. That would throw off the measurements. So, at the end of the day, that would be good. If you want to take it in the morning, wait a little bit before you get into. But then again, if you're rushing to go to work, that's stress. Yeah, that will raise it. So, yes.
But I was also thinking, at the end of the day, all the stress has already happened.
Uh-huh.
The workload and everything, well, you're kind of winding down, but you're still not completely wound down. So I'm thinking that's when my blood pressure is up.
Uh-huh.
Most times I take my blood pressure around 10 o'clock in the morning.
Uh-huh.
You know, I'm not supposed to be taking it, but I'm at work and I take it.
That's.
Before the stress actually comes down on me, I take my blood pressure and then work throughout the day.
So you are on continuous monitoring.
Yes.
To manage your stress. That's a good strategy, actually. Yeah, but looking at the convenience of it, most people work and you can't. Your supervisor is probably a bit indulgent, so it may not be the case. So when you come home in the evening, that's a convenient time to do it. So for the gentleman, we are starting a new initiative at the African American Health Program. Call it "In It to Win It." Okay, and Dr. Jeffrey Johnson, who's been doing the fatherhood initiative for the past 35 years, is the one leading that effort. And what we want to do is to get in Montgomery County, get 1,000 men to sign a pledge that they will make sure they get screened this year. It's a simple pledge, but we want to get it from 1,000 men. And that's, I will show you quickly what it is. It is, that initiative, we call it "In It to Win It," because if you do that, we all win. And it's a statement of your commitment to model good health habits, and starting with the agreement to get a health screening within the next 12 months. So you'll be hearing about it and help us reach that 1,000 men before the end of May. So that's one way of doing something about hypertension and heart disease. Okay, so this is what it looks like with the forms that you have to fill out. And I will leave that link here in the presentation. And at this, you summarize very well the action items that I want you to take When you talk about diet, talk about exercise, talk about stress reduction, talk about sleep, and all that. That's good. That's what I want you to take home with you. I will open up for further questions.
Mine is not a question, but I did try to do what you said, you know, take blood pressure every day.
Oh.
And it turns out, I guess that caused stress and my blood pressure got low. I mean, that's it. So finally, I just stopped taking it. But I guess the answer would be to take it maybe every once a week or something like that, or what?
Yes, maybe 2 or 3 times a week.
Yeah, because I was trying to be a really good patient, you know, and take it safe, just like you said. Didn't work.
It didn't work. Okay.
Yeah, I got
Get a buddy.
Yeah.
Get a buddy to take it as well with you.
Get what now?
A buddy.
Oh, yeah, okay,
Yeah.
yeah.
So that will reduce the stress.
Question about water.
Yeah.
I'm on the care of a dietitian, and she wants me to drink 8 glasses of water, 6 ounces of water a day, 64 ounces to 80 ounces of water a day. But doesn't that affect my blood pressure?
No, it doesn't.
Oh, good.
It cleans your system, and I recommend it for everyone.
Absolutely.
Hydration is good.
Okay.
Yeah. Question in the back.
Sodium. That makes you retain water.
In the morning? In the evening? Well, I would say about half an hour. Yeah, half an hour. The question is how long to wait before taking your blood pressure, whether you wake up in the morning or you get home in the evening. So give yourself at least half an hour. Yeah. You're welcome. Question.
I've got a question about race.
Mm-hmm.
I personally have a problem with people saying that race is the issue with respect to blood pressure. Because race, as far as I'm concerned, especially in this country, is a social construct. So we're all human beings. To what extent does race itself really affect your blood pressure? Is it a matter of a culture of a certain people or a group of people? What is it? Because it doesn't make sense to me when people say race actually is the reason for high blood pressure.
That's a very good question, and I would say to you, it's all the above. We are living under constant stress due to our race, and that triggers some physiological response to that, because that's what the body is made to do. It produces hormones that help you to...
But see, that's my point. It's not race that's the problem. It's the stress that's the problem.
It is, but there is also, remember I said genetics plays a role in it as well. If you have parents that have, for some reason, in the black race, it seems to be more prevalent than the white race.
But we've eaten differently. And
yeah, we eat different. That's part of it too. We eat differently. Oh, let me by my accent, you can tell that I'm from Africa. Okay, I've been trying for years to get rid of the accent. I'm comfortable with it now. Okay, yes, yes. When I was growing up, we were eating a lot of vegetables. Okay, and that was good. Both in terms of cardiovascular diseases and diabetes. Now we want to be civilized, so we taking uncivilized food called processed food, and because of it, you have those same chronic conditions are becoming more prevalent in Africa.
You know, one thing that I've observed being from Arkansas is when I go back home, my friends that I grew up with in Arkansas, most of them are gone. Whereas up here, and in Wisconsin, the other two places that I lived the longest, it's not the same at all. And their diet in the South is a lot different. A lot of meat, a lot of barbecue, especially where I came from,
Yep.
and that contributes to the problem. But that's diet and that's stress. And I just hate for people to say that it's race. I understand where that's coming from, but it's not race.
It's culture.
It's culture.
It's culture, yeah. It's culture.
Yes. Culture.
What?
Yeah, right.
I don't know about over there. I heard you say 80 but I think it's doing a lot of different things. I think that stress pervasive, going back hundreds of years. Most of the black people here in America, anywhere else in the world, here stress. And that's my theory. I don't care what anybody says. That's what I think. It contributes to something.
Yeah, it's culture. He has the
I wish they took the race
I
thing
can
away.
tell. Being from Africa and living
And race is also divisive. I wish they'd stop calling people black and white. It's divisive.
That's why we call ourselves African Americans.
I don't like it.
Yeah, all those you can't isolate. Yeah, the lady in blue there have been. Yes.
But we are not black.
Stroke and yeah. Uh, Yeah, that's an interesting question because remember at the beginning, somewhere in my presentation, I talked about the ABCs.
Yeah.
Diabetes loves company,
Yes.
okay? And the best friend to diabetes is hypertension, okay? And cholesterol. And that's why you gotta monitor those ABCs, A1C for your diabetes, blood pressure, and cholesterol. And all those, they work together, you know? They, to create the condition for, hypertension starts early, okay? Because it's silent. Now that you're gonna be monitoring yours, and your kids and grandkids, teaching them to do it, they'll be able to identify it quicker. And maybe they can do something about it. And we know the effective strategies that are available, prevention strategies. If they get on that, change lifestyle, then they will delay the processes. And same thing, the same thing you do to reduce the risk of cardiovascular diseases, it's the same thing they will ask you to do when you have a problem with diabetes. And because when one part start breaking up, like an old car, you know, you don't know what's the next one, which wheel is going to fall off.
Okay. I think with the time, Dr. Dambita, thank you so very much.